Dengue fever is a serious viral infection. It's a major health concern in tropical and subtropical regions worldwide. The dengue virus causes this debilitating illness. Millions of people get infected every year. Dengue can range from mild to severe. Mild dengue causes flu-like symptoms. Severe dengue, however, can be life-threatening. It can lead to internal bleeding and organ damage. The good news is that most people recover fully from dengue. Early detection and proper medical care are critical. Timely intervention significantly reduces the risk of complications. Dengue represents a significant global health challenge. Efforts to control mosquito populations and develop effective vaccines are ongoing. Understanding dengue is the first step toward prevention and control. Dengue virus enters the body through a mosquito bite. The virus then targets white blood cells, which are crucial for fighting infection. Once inside these cells, the virus replicates, making copies of itself. The virus's replication disrupts the normal function of white blood cells. This weakens the immune system, making the body more susceptible to illness. The virus also triggers an inflammatory response, leading to many of dengue's symptoms. As the virus spreads in the bloodstream, it can affect various organs, including the liver, kidneys, and bone marrow. In severe cases, this can lead to organ damage and life-threatening complications. Understanding the intricacies of dengue's pathogenesis is essential for developing targeted treatments and preventive measures. Dengue fever spreads through the bite of infected Aedes mosquitoes. These mosquitoes thrive in tropical and subtropical climates. They breed in stagnant water, often found in containers, tires, and open water storage vessels. Aedes mosquitoes become infected with the dengue virus when they feed on an infected person. The infected mosquito can then transmit the virus to other people through its bites. These mosquitoes are most active during daylight hours, primarily in the early morning and evening. Controlling Aedes mosquito populations is crucial for preventing dengue transmission. This involves eliminating breeding sites, using mosquito repellents, and wearing protective clothing. Community efforts to reduce mosquito breeding grounds are essential in combating the spread of dengue. Dengue fever typically manifests with a sudden onset of high fever. This fever can reach 104 degrees Fahrenheit or higher. Accompanying the fever are severe headaches, often described as debilitating. Other common symptoms include pain behind the eyes, muscle and joint pain, nausea, vomiting, and fatigue. Some individuals may also develop a skin rash, which typically appears a few days after the fever begins. It's important to note that symptoms can vary from person to person. Some individuals may experience mild symptoms, while others may develop severe illness. Recognizing the early signs of dengue is crucial for seeking timely medical attention. Diagnosing dengue fever involves a combination of medical history review, physical examination, and laboratory tests. Doctors will inquire about recent travel history, particularly to areas where dengue is prevalent. Blood tests are essential for confirming dengue infection. These tests can detect the presence of the dengue virus or antibodies produced by the body in response to the infection. The timing of the blood test is crucial for accurate results. Early diagnosis is vital for initiating appropriate treatment and preventing complications. Delay in diagnosis can lead to more severe illness, especially in cases of dengue hemorrhagic fever. Accurate and timely diagnosis is the cornerstone of effective dengue management. Section 6. Managing dengue treatment and care. Currently, there is no specific antiviral medication for dengue fever. Treatment primarily focuses on relieving symptoms and supporting the body's natural healing process. Rest is essential for recovery, and patients are advised to avoid strenuous activities. Adequate fluid intake is crucial to prevent dehydration, especially given the high fever and potential fluid loss. Oral rehydration solutions or intravenous fluids may be necessary in cases of severe dehydration. Pain relievers like paracetamol can help manage fever and alleviate pain. Close monitoring is essential, especially for signs of complications. Patients with warning signs like persistent vomiting, severe abdominal pain, or bleeding should seek immediate medical attention. Supportive care and timely intervention are paramount for a safe recovery. Section 7. When dengue turns severe, complications to watch for. While most dengue cases are mild and resolve within a week or two, Some individuals can develop severe dengue, also known as dengue hemorrhagic fever, or DHF. DHF is a life-threatening complication characterized by bleeding, low platelet count, and plasma leakage. Warning signs of severe dengue include persistent vomiting, severe abdominal pain, bleeding from the nose, gums, or skin, rapid breathing, and fatigue. DHF can lead to shock, organ failure, and death if not treated promptly. Early recognition and aggressive supportive care are crucial for managing severe dengue. Treatment typically involves hospitalization, intravenous fluids, blood transfusions, and close monitoring of vital signs. Timely intervention significantly improves outcomes in severe dengue cases. Section 8. Shielding yourself. Prevention and protection. Preventing dengue primarily involves avoiding mosquito bites. This can be achieved by using mosquito repellents containing DEET, wearing long-sleeved clothing, and sleeping under mosquito nets, especially in endemic areas. Eliminating mosquito breeding sites is equally important. This includes removing stagnant water from containers, tires, and other potential breeding grounds around homes. Community-based efforts to reduce mosquito populations are crucial for effective dengue prevention. Travelers to dengue-prone regions should take extra precautions to avoid mosquito bites. Consulting a healthcare professional about dengue vaccination is advisable, especially for individuals residing in or frequently traveling to endemic areas. Section 9. The fight continues, research and future directions. Scientists are continuously working to develop effective dengue vaccines and antiviral drugs. Several dengue vaccine candidates are undergoing clinical trials, and promising results have been observed in some cases. Research is also focused on developing innovative mosquito control strategies, such as genetically modified mosquitoes and novel insecticides. Furthermore, efforts are underway to improve diagnostic tools for early and accurate dengue detection. The fight against dengue is multifaceted and requires a collaborative approach. Continued research, public health interventions, and individual preventive measures are crucial for reducing the global burden of this debilitating disease.